That on top of that, if you go back to the rodent literature and the human literature, there is a huge list of why uremic toxins are just not good for the body. It really is something I'm always amazed at all of the literature out there. And so this is a summary list, if you will. There's a lot of things on this slide, but just some of the things that we have to think about in terms of what uremic toxins might do. They actually have a direct damaging effect to tubular cells. So if you put, for instance, if you put indoxyl sulfate in a cell culture with kidney cells, those kidney cells in cell culture will be damaged by the uremic toxins that you're putting into culture with them. We know in vivo settings that uremic toxins can promote inflammation and fibrosis in the kidney. This is, of course, a concern because your end stage kidney is that fibrosed or scarred kidney. So if uremic toxins are potentially one of the ones that are pushing you towards fibrosis, that is definitely a concern. There's also studies that show that uremic toxins promote epithelial to mesenchymal transition, meaning that you go from a normal proximal epithelial tubular cell to more of a fibrosis type, fibrocyte type cell. So that's a concern too. And then we start talking about not just the, I guess, the architectural concerns, but the other mediators of kidney disease. So one of the biggies, and not just for the kidney, truthfully, is inciting the production of free radicals and thinking about oxidative stress. That's probably another area in kidney disease that I just don't think we think about enough, and what strategies we would have to combat oxidative stress. And then activation of RAS, or the renin-angiotensin-aldosterone system. RAS is thought to be a detrimental mediator in kidney disease, so we definitely don't want to be activating that system, and uremic toxins have been shown to do that. And then from the standpoint of the well-being of your vasculature, uremic toxins can also promote endothelial injury. And we know that the vasculature in the diseased kidney is already pretty compromised, so that would not be a good thing for vascular health. We then also have all sorts of concerns with uremic toxins when it comes to metabolism and endocrine function. So thinking about it having a negative effect on erythropoietin function production, would that have then a negative consequence for anemia? Thinking about the actual lifespan of those red blood cells, their fragility and their health. And then uremic toxins also, if that wasn't enough, uremic toxins also are thought to reduce bone quality and worsen CKD mineral bone disorder. Thinking about parathyroid hormone, thinking about your bone health and your bone turnover, it has a negative effect there. And then last, but certainly not least, because we do see muscle wasting and cachexia in our kidney patients, uremic toxins are thought to have a negative effect on muscle health and cause muscle atrophy. So it wouldn't be unexpected that you would have a higher, there are studies that correlate higher levels of uremic toxins with worsening cachexia. And so that's a concern as well. So I hope that I've convinced you that there are a number of things that we would need to be concerned about in terms of the possible effects of uremic toxins. What we kind of don't know is how high the uremic toxins need to be to have these effects. I think that's something, especially for cats, that we do still need to be to discover, but there's definitely lots to worry about here.